distinguished panel of co-chairs and my dear colleagues. So if you talk to any parent, a teacher, or a healthcare person who work with adolescents in Sri Lanka or in elsewhere, South Asia, they will tell you one of the toughest tasks is to work with adolescents and youth. And if you look at the problems that they face and the spectrum of health issues that they are now living with, changing so fast due to various determinants. According to the 2007 World Development Report, 60% of the non-communicable disease risk factors are accumulated before the age of 20. So dealing with adolescents and addressing their health problems by changing their norms is something that most of our healthcare workers are looking at. But if you talk to healthcare workers, one of the main problems that they always come up with is that how to engage with youth, how to change their norms, how to address their attitudes, and finally how to change their behavior. So this particular research that we carried out as a part of our main research, just to test out a model to using health promotion principles to identify ways of changing norms of adolescents in order to change their behavior. So this was carried out in Anuradhapura, and these are my fellow researchers. So if you look at the situation of adolescents in Sri Lanka, the demographic features are very similar in Anuradhapura compared to the Sri Lankan situation as well. And the problems that they face change so fast. I would like to highlight only one information here. According to the 2019 Ministry of Health report, 12% of the newly diagnosed HIV cases were from this age group. So this is one important factor which denotes how their sexual and reproductive health behavior is changing. With regard to youth and adolescents, we know it's a challenging period, especially in relation to sexual and reproductive health, because they are sexually active, childbearing, and also there are various demands like out-of-school compulsory, out-of-school children, unmarried, and also being sexually active. Dealing with SRH with adolescent is something we found is very important. Now, why we use health promotion intervention? Because similar research done in elsewhere, the inherent property of health promotion to actively engage people and to allow them to take control of the factors which have an impact on their well-being was found to be very effective. That is one of the reasons why we use health promotion. And the objective was to identify and address norms related to sexual and reproductive health among youth in order to promote positive sexual and reproductive health outcomes. And the methodology, the study design was a course experimental study because we didn't want to do a randomization, because we took one setting just to test out this model. And study setting was Technical College Anuradhapura with a control group where the Technical College Polonnaruwa were used as the control group. And we took study participants as the young people between the age group of 18 to 25 are registered for at least 1 or 2 year courses, all are unmarried. But there are students who are doing short courses where we not included because we can't follow up them. And the pre-intervention, we collected information using 2 tools, the self-administered questionnaire, just to collect information on the norms, attitudes, knowledge, and their practices to a certain degree, and the focus group discussions used to get an in-depth view of their norms and their attitudes on the sexual and reproductive health practices. And based on that, using health promotion principles, we designed a health promotion intervention. Initially, the model was developed based on literature, and then the model amended after meeting a group of students at the technical college in order to identify a model which really suits them according to their context. And that model was finalized. Now, if you look at the health promotion intervention, there are several phases of this health promotion intervention. The first phase is initiating this process and identifying a collective goal with them, and then, understanding and prioritizing the determinants that influence norms related to SRH, and identifying the effective actions to change the prioritized determinants by this youth group, and finally, monitoring and modifying this process by giving inputs using a facilitator who's capable of health promotion and continuing this implementation of various actions to address these determinants. Now, the process was initiated with this group by dividing them into 7 groups, and they allowed to meet physically as well as, they could communicate with the social media platforms because, the youth, they're very active in social media, and then identified a collective goal and the problems that they wanted to address. And also during that time, we tried to identify some of the norms that is prevailing among them. Then the determinants, during this phase, we use several simple tools to identify the list of determinants that they think are the ones which control their norms related to SRH. And finally, some of these determinants are prioritized. So 3 major determinants are finally identified, which they found to be impacting on the norms of SRH. 1, negative media influences, gender stereotyping, and lack of knowledge on SRH and various myths related to SRH. And the monitoring and modifying this process continued during a period of 6 months after initiating this process with the help of a facilitator. So implemented actions were mainly focusing on addressing these determinants. And you can see some of the actions carried out by students. I want to highlight this. All these actions were mutually developed with the youth. By actively engaging them, the facilitator gave some inputs for them. So interactive discussions were conducted and also tried to understand the prevailing norms. And during these conversations, the facilitator tried to improve their knowledge and also allowed them to identify ways and means of looking for the right knowledge and share this knowledge using the social media platforms and various tools, simple tools developed by them to share this knowledge. And the media influence, they worked with Facebook, they developed video clips and various dramas among them to educate the fellow colleagues how the media influences norms, especially with regard to SRH. And also they found, they developed various activities like special dates to talk about SRH, and they developed various materials by themselves to share in WhatsApp and Facebook. And this is one way of empowering their capacity to address gender norms and SRH norms. Then finally, the data were collected after the intervention using the same tools. The analysis was done, the quantitative data analyzed using descriptive statistics and analytical statistics. Qualitative data thematically analyzed, comparing pre and post of only the intervention group. And ethics approval was taken from the Ethics Review Committee of the Faculty of Applied Sciences, Rajat University of Sri Lanka, and the permission was taken from the director and principals of both technical colleges. And consent was taken appropriately, and anonymity and confidentiality was highly protected. And if you look at the results, these intervention group and control group, they were predominantly in the age group of 20 to 22 and female in nature and, currently having some kind of an affair but unmarried. And if you look at the results on knowledge on anatomy and physiology of reproductive system has significantly improved, and awareness on different contraceptive methods improved after the intervention, even though the knowledge or the awareness increase is not the main part of the intervention. You can see even the most uncommon contraceptive methods, the knowledge on uncommon contraceptive methods was significantly improved. And the most important part is here, the norms related to SRH. Now, such as, I believe that getting pregnant before 18 years is okay if they're married. So that kind of norms were significantly changed during after the intervention. So initially, the number who agreed and disagreed with these statements significantly changed after the intervention. So these are some of the statements. If a girl suggested using condoms to her partner, it would mean that she didn't trust him. So initially, that some, to a certain degree, nearly 50% believed that yes, but then most of them strongly disagreed with these norms. And these are some of the other norms, such as girls should obey the decision of the boy without argument to maintain a relationship. Earlier they thought yes, but later most of them disagreed with such norms. And using condoms reduce sexual pleasure. Initially they thought yes, and after the intervention we found in the intervention group mostly they believed no. And using contraceptive methods during sexual intercourse, this is something that I want to highlight. There was a group, like 17 members were having, even though they are unmarried, in this age group, but they were having intercourse or sexual relationship. There is, you can see the improvement in using contraceptive devices during their intercourse. So my conclusion is that you can see this intervention to a certain degree helped youth and adolescents to actively engage in a process to improve their knowledge as well as their norms in relation to sexual and reproductive health by addressing some powerful determinants which shaped their norms.